Good afternoon, everybody. Michael Lepore coming to you again to talk a little bit on Whiteboard Wednesday. And we're going to expand on carotid artery disease, and I'm going to talk about a specific procedure to treat carotid artery disease. Transcarotid Artery Revascularization and stent. Well, it's a way to basically open a carotid artery, which I've spoken before about the reason. So let's just skip that part and say somebody's got a greater than 80% carotid artery blockage in an asymptomatic patient. We have a couple ways to decide to treat them, whether it's going to be an open carotid endarterectomy or transcarotid artery revascularization, or TCAR, which we're going to stick to for now so I don't have to keep saying that. This is a carotid artery here. The internal carotid artery goes up in this direction, and you can see there's a blockage here and a narrow channel that's right there. Again, consider it to be greater than 80% blocked, at least in an asymptomatic patient. Once we get exposure to the artery from just above the clavicle and go down to where the artery is, get the artery out so we can see it, and then a device goes into the artery, which is a sheath. And that's what this represents. We take another sheath, and using ultrasound to identify the vein in the groin, we put a sheath in the common femoral vein in the groin. We hook these two tubes together, and there's a trap right in between in the whole circuit that's like a screen material, so it captures anything, and then the flow gets reversed. As the flow's reversed, we then take a wire and get a wire up through this blockage and up into here. A balloon goes up and opens up this so that the artery is now open, but the artery may not stay open, and you want to protect that blockage from going anywhere. So then we deliver a stent that goes like this and traps anything behind it. This comes out, the artery gets closed, and then the sheath comes out and pressure is held at the groin. The advantages to this procedure are that it's got a little bit smaller incision, a little less risk from versus open surgical techniques, but you have to have enough room between the clavicle and where the blockage begins to be able to do this procedure. So it does have some anatomic deficiencies in terms of being applicable to every patient. So in summary, transcarotid artery revascularization for carotid artery stenosis, or TCAR, is used to treat blocked carotids. It's a newer technique in terms of the device. We've been doing angioplasty for many years, but this device has revolutionized and lowered the stroke rate in this procedure to less than 1% in the right hands. Thank you for joining me on Whiteboard Wednesday. Michael Lepore again. I'll be talking to you soon.
Thank you.